Hi, my name is Nikki and this is career profile number 2. For my second career profile, I chose to look up marriage and family therapist, or therapy, because that's what I want to be. An example of organization is Berkeley Creative Wellness Center at bonitahouse.org is the website. And the address, they had a P.O. Box 3037 Berkeley, California 94703. And their phone number is 510-548-2269, and their email is info@bonitahouse.org. So I do not know anyone in this career. For the working environment, basically, marriage and family therapists usually work in a medical clinic, hospital, or other medical facility under the supervision of doctors. They might also work in a social service offices or community and mental health facilities. Many marriage and family therapists also choose to open their own private practices. Few marriage and family therapists might even make house calls, which involves visiting the household to observe the living conditions. So that can also be an option. Typical stressors are, it can be very emotional draining. Marriage and family therapists have to work hard to not take sides because they'll literally find themselves in the middle of arguments all the time. And so it can be very stressful. They're going to talk about abuse, infidelity, post-traumatic stress disorder, depression, and grief. And so, they might find themselves also in situations where they have to work with people that are in situations that they may not honor or agree with. For example, the marriage and family therapist may feel that the couple should get divorced, and they may be completely against that, and so they kind of have to work around that. Or they might work with maybe same-sex marriages, and that's something that they may not honor, but again, they have to work with that, and so they're gonna have to accommodate to what the family prefers. Typical benefits: they work usually a 9 to 5 Monday through Friday schedule, and sometimes it will require for them to work in the evenings. It just depends on what organization you work for, and you can get a paid vacation, a sick leave, holidays, life insurance, and retirement benefits. In addition, a yearly bonus of about $2,909 will be accredited to his or her account. And so just with the 95 schedule, it just allows them time available with their family and things like that. Common job tasks for marriage and family therapists, it ranges from it's from a wide range of serious clinical problems, including depression, marital problems, anxiety, individual psychological problems, child-parent problems, kinds exposed to trauma and debilitating conditions. And so they are to share the individual's emotions and experiences to treat family problems, and they counsel their clients based on their reaction to circumstances and provide support to adjust to significant changes in their life. And so marriage and family therapists treat the family as a whole. It's not just a person, but even if the only single person is interviewed, it is a set of relationships in which the person is embedded. So it's a brief, solution-focused, and specific with attainable therapeutic goals, designed with the end in mind. And so their main job is to treat the patients, improve the routine skills of patients, administer the medicines, learn the patient's progress, and adjust the treatment following the guidance of medical professionals. For educational requirements, to become a marriage and family therapist, you just need to complete an entry-level education, meaning a high school diploma, GED, or anything equivalent, before enrolling in a 4-year bachelor's degree in either social work, psychology, sociology, or related field. After completion of bachelor's degree, there are 3 options available. You can get a master's degree, which is anywhere from 2 to 3 years, a doctoral program, 3 to 5 years, or postgraduate clinical training programs, which is anywhere from 3 to 4 years. After graduating from an accredited program, a period usually of 2 years of post-degree supervised clinical experience is necessary before the licensure and certification. And so the amount of supervised clinical experience just depends on the state that you want to do that in. And after that period of supervision, the therapist can take a state licensing exam, or most states also do the National Examination for Marriage and Family Therapists, which is conducted by the American Association of Marriage and Family Therapy. Starting salary. So salaries vary widely and is determined by a variety of factors such as geographic location, age of marriage and family therapist, type of employer, experience, specialized qualifications, and work settings. According to the U.S. Bureau of Labor Statistics, the starting salary is about $25,230 per annum, while an average marriage family therapist receives an annual salary of about $46,240 per year, and a well-established marriage and family therapist makes a much higher salary of about $74,550 a year. Other information. Employment of mental health counselors and marriage and family therapists is projected to grow about 29%. That was from 2012 to 2022, and that's much faster than the average for all occupations. Growth is expected in both occupations as more people have mental health counseling services covered by their insurance policies. And then I ran across a marriage and family therapist named Robert Salinger, and he just suggests that before we become a therapist, to clean up your own backyard. So get your own therapy straightened out and resolve the issues that are going to get in the way, because it's going to be counterproductive for a therapist to have a legion of unresolved personal issues that could block the ability to provide effective guidance. So that is my career profile number 2. Thank you for watching.